Hello, my name is Dr. Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take a few moments to talk with you about the surgical treatment of erectile dysfunction or impotence. Erectile dysfunction or impotence is first treated with medications such as Viagra, Cialis, or Levitra. Then, if those treatments do not work, then there are injections, pellets, or a vacuum erection device. In the event that those are ineffective, then there are surgical procedures for the treatment of erectile dysfunction. A penile prosthesis is a surgical procedure that is accomplished by the insertion of the device through a very tiny 2 to 3 inch incision at the lower end of the abdomen. The insertion of a prosthesis allows a man to create an erection whenever he wants, and the erection will last as long as the man wants the erection to last. There are essentially two types of penile prosthesis. There is the semi-rigid rod, and then there is the inflatable penile prosthesis. A semi-rigid rod consists of the insertion of a rod that is wrapped in silicone at the base of the penis and allows the man to either, one, create an erection or push the erection down when he does not want to be sexually active. The main disadvantage of this procedure is there is some moderate difficulty with the concealment of the semi-rigid rod. However, the advantage is that there are no moving parts, and except for the minimal problems of concealment, it is very satisfactory, and most men are able to elevate it to engage in sexual intimacy, then place it down into a flaccid position when he wishes to conceal the erection. The most popular penile prosthesis is the inflatable penile prosthesis. This was developed in Houston, Texas by Dr. Brantley Scott, who happened to be my professor in 1976. There have been over 500,000 of these devices implanted worldwide, and each year 15,000 of these are implanted in the United States. Through my career, which began in 1978, I have inserted over 3,000 of these prostheses. The prosthesis of the inflatable variety consists of two cylinders that are placed in the erectile bodies of the penis, a reservoir which is placed behind the muscles of the abdomen, and a pump which is placed into the scrotum. Everything is entirely concealed, and no one can detect that the device is in place. When a man wishes to have an erection, he squeezes the pump in the scrotum, and the penis then becomes erect with the fluid that is moved from the reservoir to the cylinders. The fluid is nothing more than a salt solution, and there is no problem if the salt solution leaks out of the system. When the man wishes to have his erection subside and return to the flaccid position, the man squeezes the valve over the pump in the scrotum, and then the penis returns to its flaccid condition by having the fluid move from the cylinders to the reservoir. The man who has the device in place can comfortably go to a public shower such as the YMCA. No one can detect that it is in place. His partner, unless under the closest of scrutiny, could be able to detect that the man had a prosthesis. The procedure is usually performed on a one-day stay basis, either at an ambulatory treatment center or at a hospital where the man checks in the morning, has the procedure, and then goes home an hour or two later. Most men can leave the hospital after they urinate, and most men, if they don't have a problem with urination before the procedure, they won't have any problem urinating in the post-operative period. Men are given antibiotics and pain medication, antibiotics to prevent infection, and pain medicine for the post-operative pain, which usually persists for 2 to 5 days after the procedure. Most men can begin engaging in sexual intimacy 4 to 6 weeks after the procedure is performed. Most insurance companies, including Medicare, will pay for the operative procedure. There are potential complications associated with the surgical insertion of a penile prosthesis. These complications include infection, bleeding, and failure. Rarely is bleeding or infection a problem, occurring in less than 3% of the cases. Failure of the device to work occurs in less than 5% of the patients. If the man has the device and used it for several years, which is common, and then experiences a failure where there is loss of fluid from the system, it is a very simple procedure to go and make an incision and find out where the leakage is in the hospital and repair the system, and the man can then return to normal sexual intimacy with his partner. The procedure is successful in well over 98% of the patients, and very seldom has the device have to be repaired or replaced. Also, I point out that patient's partner satisfaction is nearly 100% after the insertion of a penile prosthesis. So, in summary, erectile dysfunction is a common problem affecting millions of American men. The diagnosis is easily made, and most men can be helped with oral medication or with injections or pellets or a vacuum erection device. However, if those are ineffective, a surgical procedure with the insertion of a penile prosthesis is nearly 100% effective in men who choose this treatment option. So in summary, nearly every man who has a problem of erectile dysfunction can be helped. Today, no one, and I genuinely mean no one, needs to suffer the tragedy of the bedroom. I know you may have some additional questions regarding the treatment of erectile dysfunction with a penile prosthesis, and I would like to recommend that you go to my website at www.neilbaum.com or give my office a call at 504-891-8454. Thank you.